Nurses sacrifice so much for the community, and it's only fitting that we celebrate them for the many roles they play in our lives. To this end, the United Nations have set aside a week to honor nurses and midwives for their sacrifices to mankind. The week-long celebration takes place between the 6th and 12th of May every year, and the theme for this year is Nurses Make a Difference. Now with me in the studio, the Executive Director, Nurses on Air, Ayanfe, Owolabi. Thank you so much for being here.
Thank you so much for having me on the show.
Right, and I also have joining me via Zoom, a registered nurse and family care consultant, Julie Mogbo. Thank you so much for being here on TBC Breakfast.
It is my pleasure to be here.
Nice. So talk to us, let me start with you, Julie. Talk to us about the significance of marking this week, the National Nurses Week.
Thank you very much. The celebration is very significant in terms of the fact that it is really important for the world, for the society, for every individual, institutions, organizations to come to the full knowledge of what nurses stand for. It is important for our voices to be heard because the nurse is a key individual when it comes to the issue of life, and life is all encompassing. We have this celebration, one, to let the world know what we stand for and why we do the things that we do and why our voices need to be heard. And also for the nurses, it's an opportunity for them to come together because there are events all over the world marking this day, an entire week. So nurses have a little break from their regular routine. They network, they attend conferences, they learn from other people, they interact together, they acquire more knowledge. So it's quite significant because the profession is noble, the profession is integral to the healthcare system. So it's important for us to have this celebration because it's a kind of break that we have, like I said, and an opportunity for the world to hear about nurses and know in a deeper level what we really stand for.
Right, let me bring it to the studio. Ayodeji, what does this celebration mean to you? Like being a nurse yourself and someone who has been practicing for years, what does it mean to you to be celebrated this week?
Globally, there are a lot of challenges that nurses are going through, especially with delivering quality health care with the resources that they have. Yet they still do this with their own strength, with more compassion to help patients to sustain their health and to help promote health. Despite the challenges they go through, they need more support. Despite the challenges they go through, they still do far, far beyond their own strength. This is well seen during the COVID-19 pandemic. And that is why they're saying, even before now, that let's celebrate nurses globally. This started from the era of Florence Nightingale, based on our contribution to the sustenance of the health of soldiers during the Crimean War. Then they said, let's dedicate our birthday to celebrate nurses globally.
All right, let me go back to you on Zoom, Julie. The government is responsible for the welfare of Nigerians, of the people generally, the citizens on whom they, superintend. So taking care of the nurses and midwives is just like taking care of their citizens. So what would you say the government, how would you say the government has done, or how far have they done in this regard?
All right, so that's a very tricky question because if we were to look at where the ideal, where we ought to be, how the nurses ought to be placed, and how much recognition is to be given to their work and their contribution to the healthcare system, we might want to say that the government hasn't really done much. But when we look at our peculiar context as Nigeria, with what we face even in other industries, we will say they've done fairly. Fairly in the terms of having a council, a regulatory body, funding to have the regulatory body to ensure that the practices are well regulated, the curricula is well taken care of. We are having more institutions come up. We are having nurses being trained and pumped into the society. When we look at the clinical area, we have our government facilities. Yes, there's sometimes provision of a bed and a number of things. They're doing the bit that they can. But when we look at the challenges that we are up against, especially during the pandemic, 2020, as bad as it was, it opened our eyes to see a lot of things, to see the gaps, the huge gap that we have within the healthcare system. That year made the government see that there's a need. But how well have we done? There's still a lot of work to do, if you ask me. I usually would say that the government show where their priority lies by the things that they do. There ought to be a lot more done within the healthcare sector. Now, we are not just even looking at, a lot of concentration has been done in the clinical setting, but the healthcare institution is just one aspect of healthcare. What happens to the preventative? What happens to those in the homes? What happens to the streets? We have a lot of problems and challenges related to health on our streets. And nurses are available to take care of the whole chain from before someone falls ill to the point that they fall ill and they are within on admission within a hospital setting and rehabilitation after they have been discharged. How much of understanding does the government have of the roles the nurses play? Well, fairly, like I said, in our context, they are doing the bit that they can. But I think I'm going to challenge the government to do a lot more, because there are a lot happening in other climes. They are aware that our nurses are leaving on a daily basis. So they need to find out what is it that these other countries have that is enticing our nurses? Why can't we retain them? Why are they leaving? Why are we training them for other nations? So these are conversations that the government should have. A lot more is still there to be done.
Well, a lot more might not be very specific. I'll definitely come back to you. You'll tell us some of the things, more things that they need to put on the table. But then, Ayodiji, judging from the treatment of nurses and midwives in the country, so far, does this, looking at the welfare and all that, are people still attracted to this profession after all?
Okay, I would say people are attracted to this profession because it is an opportunity for them to leave this country, not an opportunity for them to give back to their country. The country is not giving what they need based on what they've studied. The country is limiting the knowledge that nurses have. The country is limiting their strength, their skills, and their experiences. The country is making them feel as if they don't want what they have. But when they see the opportunity outside Nigeria, and they could see a place that could match with what they've studied, a place that could match with what they've read in different novels, in different articles, what they've heard in different seminars and workshops that they've gone to, they will rush to the place. UK is begging nurses to come, please come. US is creating doors for nurses to come. Northern Ireland is doing the same thing. There are a lot of countries that are begging Nigerian nurses because they feel that Nigerian nurses are not being appreciated enough. But our country is not seeing the worth of this set of professionals. So this is making a lot of people to think of, okay, will I still stay here and not be able to sustain myself and my family? I'm presently in this country because I'm working in a place that they have the standard of care and they're after providing quality health care to Nigerians. How many organizations in Nigeria, especially government-owned organizations, can say they can provide quality health care to Nigerians? Many people rush down to our hospital because they feel, oh, there is a place that they can get good care. Yet, the hospital is still programmed alongside with what happens in Nigeria. The hospital is training a lot of people, and people are living in masses. In fact, they are almost regretting that. Are we training people to global standards to leave Nigeria?
To outside countries.
Exactly.
But is that to say that, going to school to study this profession, to acquire more skills, is an automatic visa for you to get out of the country? Is that the point you're trying to make? Okay.
I won't say it's automatic, but it gives you more edge than every other set of people. Now, you're working in a place where you as a nurse, you are attending to 30 patients. Yeah. You are working in a place where you as a nurse, you don't have enough facility. Even some government-owned hospitals, I don't want to say in Lagos State, don't have light supply to do what they want to do. Yeah. Some use torch from their phone. This is affecting a lot of people to do what they ought to do for their patients. This is draining their own energy. Some people will get some. A friend of mine had an accident recently. I'm sure it could be related to being tired when driving or when coming back from work. So a lot of people are going through a lot of things, and they feel they can't just keep in this shape. They can't just be bottled up in this community. That is why a lot of people are living in mass. And it will continue to go on like that until Nigeria can come to their thoughts of what can they do to sustain these people. Let them provide quality equipment for nurses to work. Let them give them good pay, because we can't take it out of it. Before, it used to be a profession of you're doing it for the mission, you're doing it to save people. But now people are getting to understand that you went to school, you spent millions of naira to get your certificate. Your parents invested in you. So you should be able to give back to yourself and also to your family. So let there be more investments. Globally, they are talking about investment in nursing. Is this country ready to invest in nurses? Are they ready to invest in their knowledge and skills? Are they ready to invest in the healthcare sector globally? I mean, in this country, to give them what they need financially, morally, and all spheres of their life, whereas other countries are providing this to them. So they will be willing to go to another country that are providing this than staying back in this country.
Well, quite amazing. Julie, let me bring this to you. He's actually raised the issue of brain drain. And report says that our country has lost more than 11,000 nurses and midwives to, other developed countries. Between 13,000, imagine, between 2019 and this year, 2020. So talk to us about how these has been affecting the profession, especially as compounded by the attrition of midwives and nurses.
All right, so first off, when I heard you introduce Owolabi, I was like, so he's still in the country. And I'm sure he would have the same thoughts about me, hearing that I am still here. So it's not a question of if you would leave. The question is, when are you leaving? What country are you leaving to? That is one. Two, we have seen ourselves, including in our interview questions, because I'm a nurse entrepreneur. I have been doing nursing business for quite some time. So I have found myself, when I'm recruiting nurses, to ask the question, what is your migration plan? So the first reaction is that nurses wouldn't want to say. I said, hey, we know if nurses are leaving, but just let us know what your plans are so it can enable us plot our graph properly so we know when you are leaving, and then we know we have to find a replacement. So it's not a question of are you leaving, it's when are you leaving. Talking about the impact it's had on us, for those who are currently on ground still in Nigeria, it's giving us a whole lot of work. Those within the hospital, they are already short-staffed, and now nurses are leaving. They're looking for people to cover shift. And then when we have certain cases that need perhaps 15 minutes or quarterly monitoring, or they need someone that would be on a patient for 24/7, the patients themselves are forced to pay more to get a private nurse because the nurses in the hospital are not enough. They are short-staffed already. But people need quality care. They need adequate care. They need sufficient care. They need their nurses around them. But where are the nurses? So it's further compounding our problems in terms that the patients are not getting the quality care that they deserve because they have a right to quality care. So they are not getting it. Then in our economy, it also has an adverse effect because the nurse is trained to render care. And as our care needs are dynamic, the nurses are available. It might surprise you to know that globally, there are over 100 specialties in nursing, cutting across every sphere of life. Cutting across every sphere of life. And I tell you, over 100 specialties in nursing. Imagine if Nigeria opened up their doors to this specialty and empowered nurses to carry out responsibility. One, I'm going to tell you, when patients are in the hospital, some patients don't have a business staying long time in a hospital. Imagine if we had extended care facilities managed by nurses, nurse-led facilities. So the doctor discharges the patient, tells the patient, in fact, let me even share an example. Last December, we had a case, the family was forced to get private nurses. They were paying more while on admission. And then when I got to find out the history, I discovered that, oh my goodness, if they were aware that it was possible for them to get home care services, they would have asked for a discharge, because the case that we went in there to manage was a case that was gotten right from the hospital. There's something called nosocomial infection, hospital-related infections. Now, if this patient was treated and then discharged to an extended care facility, that patient would not have contracted that infection. And sadly, the patient died. So let's have our government invest in nurses. Let's have them save themselves and make themselves some money to better improve the healthcare system. So it has, we cannot start elaborating the impact that it has. I would call more, challenge the government more to have more conversations, more roundtable conversations with nurses, so that we understand our patients' needs. We understand the problem because we face them in the hospitals. I am not working within the hospital setting. I consult with hospitals because I discovered that there's a lot of challenges outside of the hospital. Pre-admission, that's not so many conversations are being had in that area.
Yeah, Julie.
And we're just very few. So when nurses are leaving, it's more challenging for us to manage these health needs.
Right, Julie, I would advise that you don't motivate Ayodeji to leave Nigeria. You know, when you say you express them, you know, shocked that he's still in Nigeria, you don't want to go anywhere because we need you back here.
If you ask Ayo, Ayo is going to be wondering the same thing about me. Just ask him. He's wondering why I'm still in the country.
Okay, I'll ask him. But the thing is, if other countries would not be beckoning, you know, to you to come over to their countries to come and practice and all that, if we are not producing nurses, midwives who are, you know, up to standard, who are skillful. So it means we are doing well in training them.
Exactly.
What do you think is responsible for not taking care of them? Why do you think we are trying to take care of them, but because of the external factors such as the, you know, the battered economy, you know, the challenges that we're faced with, a lot of money being pumped into here and there, could it be as a result of that?
Now, if we look at the focus of Nigerian government, it was only shifted to health during the COVID-19 pandemic. But after the COVID-19 pandemic, it is shifted to politics. So anything you focus on will be more magnified. If you're focusing on health of Nigerians, then you will think of what can we do to make sure that people are living healthy. Nigerians are not asking for too much. They're asking for their ability to stay healthy and to enjoy what is available for them. But this is not being provided. Meanwhile, in UK, their health care is completely free. You go into the government hospitals, you get free health care, which is being provided by the government. So their own government is recruiting nurses from different parts of the world, not only in Nigeria. Despite that, we have a lot of nurses that are being trained in UK that are leaving UK to other countries as well. So they are seeing the fact that their nurses are leaving to other countries that are providing better payments, better facility than them. Then they are also getting from people that are also providing less facility and less care to their nurses. They are inviting them to their own country. So Nigeria, if we are also seeing that there is a gap, we shouldn't only focus on training nurses. We shouldn't focus only on creating more platform for nurses to be created. To be trained. We have now they've created different cadres of nursing that could allow them to have more nurses in the community, that could allow them to have more nurses being trained in schools of nursing, unlike before. Before it used to be 50. Now I think they've increased it to 7,500 per school. Despite that, I can tell you for a fact that people that are still in school are already writing their exam to leave this country, even before they graduate from the school. So this is still going to affect us until we come back to our thought and say, what are we doing wrong? What are they doing right in other countries that they are not doing in our country? When my facility started, they drained a lot of nurses from different hospitals across Lagos, and that affected their own nursing workforce. And the other institutions think of, okay, what are they doing right in this facility? This facility came with the thought of what is happening outside Nigeria. They came to gather a lot of nurses from Lagos and other parts of Nigeria, and they selected the best to give care to their patients. Patients are trooping in masses. If Nigeria can think of a private sector doing this in Nigeria, then why can't the government do same thing in this same country? If people from outside Nigeria can come and invest in healthcare in Nigeria because they see that there's a old gap, there's a lot of gaps in healthcare system.
Yeah.
There are a lot of things that can be done outside the hospital. We can digitalize healthcare. The world is tending towards digital platforms. We can digitalize healthcare that people can have access to quality healthcare from their homes, from the comfort of their location. We can use this as an avenue to reduce the walking into the hospital. We can use this to reduce the stress on people that are still available. Yeah. We can do a lot of preventive medicine, giving healthcare education to people in communities. To some people that doesn't have access to quality healthcare, they can prevent their healthcare. So if this is being sorted even before coming to the hospital, it will reduce the workforce in the hospital. If we can create a channel for people to have access to some little information that will even allow them to have access to care, even at the comfort of their home, then this will be sorted and reduce the workforce in the hospital as well.
All right, Julie, on a final note from your end, how imperative do you now think, including midwives and nurses in decision-making on policies, health policies in the country?
It is very, almost 100%. Reason being that nurses spend 24 hours with patients. They get to understand patients' needs, but oftentimes when they are not included, even at the institution level, if they're not included when hospital policies are being formed, they realize that the patients are being shortchanged. The patients aren't getting the best. So when you want to take care of life, let's just get that. When it has to do with life, you must, as a matter of necessity, involve a nurse and a midwife in having those conversations because they understand the patient needs. Oftentimes, we have patients who will inform nurses about certain things. The nurses will say, okay, so when your doctor comes, let him know. And they say, no, some patients don't want to tell some of their doctors the things that they share with nurses. So nurses should, and if we do not allow nurses share their opinion, lend their voices to policy making, many of our nurses are experiencing depression. We have statistics. So it's important for them to do that because they have full knowledge of patients' needs.
Thank you very kindly. The Executive Director, Nurses on Air in the studio, and your Deji Owolabi.
Thank you so much.
And also via Zoom has been registered nurse and family care consultant, Julie Mogbo. Thank you so much for your time too.
My pleasure.
And I also want us to, we also remember the over 5,000 nurses and midwives worldwide who lost their lives during the 2020 COVID-19 pandemic. Our hearts go to you and their families.